How you doing, guys? This is Dr. Sun at Specific Chiropractic. In this video, we're going to talk about long COVID syndrome. You know, what it is, what symptoms are, and also how we help people with it, okay? So, I understand this is actually your fourth time having COVID?
It is, yeah.
Okay, and you just had it, was it 4 weeks ago or so?
Just had it 4 weeks ago over Christmas and New Year's.
Okay.
And it was as bad as getting it the first time around.
Okay,
the other 2 times were just like a cold.
Gotcha. So the first time you had it, you actually lost a lot of your senses.
Correct.
Which is?
Sense of smell, sense of kind of hearing, taste, blurriness, vision, sense of stability. And it felt like I had to work on normal, chores of walking around the block was just out of breath. About 3 months after, finally things started coming back together. And this time around, I didn't lose the smell, I didn't lose the taste, I had all my senses, but I just feel weaker and more like I'm overcompensating. The body's just working harder.
Gotcha. How's your breathing right now?
Right now it's fine. I just feel a little tight.
Okay, so I feel like someone's like sitting
on it, yeah.
You're right. So you have a little tightness of the chest over here.
Yep.
And during consultation, you also mentioned that you still have some residual short-term memory issues.
Yeah. A little bit of memory, and then, if you don't write something down, or if you're going on, let's say, shopping, just food shopping, and you forget stuff, if you don't do like a little to-do list, or you think you have 5 things to do and you forget, let's say the laundry's done, and then you forget about it.
Gotcha.
So it's just little things, but they add up throughout the day.
Understood. Now, in terms of all these issues we're talking about, okay, you used to lose your sense of smell, taste, short-term memory, breathing issues, and so on and so forth, okay? Now, I still don't understand the full mechanism behind it, but what I have noticed with a pattern with more than 200 plus COVID patients I've had over here with long COVID syndrome, there's a misalignment in the upper cervical.
Okay.
Now, it's very subtle on you, but I do see a misalignment where your skull is supposed to be parallel over here, but no, it's like a little open on the back over here. Okay. Now, the reason why that's concerning, okay, is because we actually have 3 areas of our brain, but important component of it is actually the brain stem. The brain stem extends from the skull all straight down to around the 2nd or 3rd cervical, the very top part of your neck. Mm-hmm. Now, the way that the mechanism goes about is that the skull itself, if it misaligns going forward, it will irritate and put irritation onto the back of your brainstem. If your skull goes backwards, posterior superior, it may put pressure on the front part of your brainstem. Okay? So that's why there's some different types of symptoms some patients experience when they have COVID. Okay, and some things may be more severe, and some others may be different. Okay. But in your case, since it's backwards like this way and an open gap over here, I'm going to take a closer look, see what's going on with that occiput. And we see over here as well, your occiput, the skull itself, supposed to be straight. But yet it's tilted this way. Instead of here, we're lopsided, over towards this way. Yeah. You got it. And it's also rotated as well. So we're going to take a closer look, see what's going on with that occiput over there on the left-hand side. Now the viewers can see right off the bat, okay, there is so much swelling. You can also come a little closer look over here. There's so much swelling on the left-hand side, not much. But you see this stork bite sign over here? Okay, that usually happens from inflammation of the upper cervical. So yeah, there's even more indications, something really going on over here. And when we take a look at the rest of the spine, okay, this is swelling over here. You have some swelling over here. Swelling over here as well. But here's the other component, okay? If there is clearly an upper cervical problem, I'm only going to be adjusting just this upper cervical itself. We're not going to touch anything else. Why? Is because in terms of the nerve system, we have 2 important areas, sympathetic and parasympathetics. Easy way to explain it, one's a gas pedal, the other one's a brake pedal. We don't want to ride both gas and the brakes at the same time while we're driving. No different to the nerve system as well. So we're scanning the spine. And here's another component as well. Right now I'm seeing some mild core pressure. That means the spinal cord itself is irritated and is going straight all the way right down, staying stuck. 3 points all straight down to the rest of the body. And we take a look at the top part. Same story. It's 3 points all the way. And there's that reading right there. Now it just swings over to the left, 10 points up there. Now there's some other challenging issues. We're going to cover that on a different video. And I'd love to include all that stuff, but right now I'm prioritizing with her is that the main issue we're addressing today's video is her long COVID syndrome. Tendon right there, huh?
Yep.
Yeah. Ooh. A lot of tenderness right there, huh?
Yep.
Yeah.
Try not to make noise.
It's all right. It's all right. So now, once again, because now there's so much irritation and compression onto the brain stem, it's shutting everything down. In essence, what we got was the whole entire upper deck of the GW bridge just shut down. And we have a massive traffic jam on the Cross Bronx and also the Jersey side as well. So right now, even though she has so many a huge laundry list of other health issues, we have to triage and take priority. Right now, the more utmost priority is we have to reestablish communication from the brain to the entire body itself. So this one over here, everything's pointed out, says, okay, we really need to address this skull over here. It's very swollen, very tender over here. Okay. See, everything's moving decently. And then when we start testing the occiput, see, right there. Oh, Nelly, it's right there. So we definitely got a PS occiput right here. So this is the fellow we need to address. Just breathe. Right there.
Oh!
Well, that was a biggie. Everything okay?
Yeah, it's just like very, felt like a lightning rod.
I know it was very intense. Go ahead, walk around, please.
I can feel my left side.
Oh, what was it before?
It was stuck. I feel it's so funny. It's just like a lightning jolt, and now it's fine. I mean, not that it's fine, but it's tender. But
Of course.
I can feel it. Before I couldn't feel anything, and now my ear feels like it actually went back. Does that make sense?
It certainly does. Why? What were you feeling differently with that ear?
The ear joint was going. The TMJ joint was going into my ear canal and blocking, and now I can feel normal or balanced at least.
Okay, that's good. What other differences do you notice right now?
Opening and closing my mouth. It's still very tender on this side, but it makes it easier. It's
Okay.
a little clicky, but it's not moving into the ear right now.
What about, how's the breathing right now?
A little easier, and this is not hurting anymore. It's tender, but it's not locked. If that makes any sense.
Progress. How's the memory? How's that feel?
So far, so good. We'll see what happens. I'll let you know.
What about brain fog or any other?
Nothing.
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 All right. Pretty nice, huh?
Yes, feels looser.
Okay. So now here's a story, okay? Because that fellow was so swollen, as the viewers can see, there was a lot of swelling on that left-hand side. So your homework is this: I want you to put a cold pack right there.
Okay.
I want you to pump all that fluid out of the area over there. And we're going to see you in the next visit. You let us know how all those symptoms come about.
Okay.
All right?
Sounds
Okay.
good.
All right, we're all set.
Thank
See you
you.
next time. Oh, you're welcome.
Thanks.